BC's Health Minister Josie Osborne says U.S. doctors and nurses have been contacting the province asking if they can work here.
With the uncertainty and chaos that's happening down south of the border, it certainly doesn't come as a surprise.
BC's response, a fast-tracked process from 5 to 8 months to just 6 weeks for doctors with American certifications to take up practice in BC. BC's also going after those U.S. doctors or nurses with an ad campaign, similar to what it did in the UK. Dr. Habib Rahman and his wife, also a physician, answered that call.
Since arriving, we've been amazed every day by the natural beauty here. We've also been warmly welcomed by so many British Columbians, and without fail, when they get to know that we're family doctors, they initially celebrate our arrival and immediately follow that up by asking, are you taking on new patients?
The announcement came on a raucous day in the BC legislature, with the opposition Conservatives grilling the government over not meeting healthcare needs in BC's fastest growing city, Surrey.
18-hour waits, pediatric care in portables, and unsafe working conditions for our frontline workers.
Surrey, despite this government trying to blame past governments all day long, has grown 200,000 residents since they took office, yet they have not kept up with the pace of growth.
The government has had a primary care strategy for 7 years. It's matched 675,000 people to a family doctor or nurse practitioner, but still 400,000 residents remain without, something the health minister says the U.S. Doctor Initiative will help with.
With 400,000 people on the Health Connect registry and doctors taking panels of up to 1,200 patients, say we can know that we're going to need dozens and dozens of doctors.
BC's U.S. doctor recruitment efforts will target Oregon, Washington, and California later this year, and hopefully not compete with efforts being made in other Canadian provinces such as Ontario, Nova Scotia, and New Brunswick. BC wants U.S. doctors to fill gaps here in cancer care, emergency rooms, and in rural communities. Chad Pawson, CBC News, Victoria.